Which doctor? Hey, welcome everyone. Welcome to my channel. Everyone will be here, will be watching. Everyone will be around. And it's been a while. Yesterday we did a topic. Today also we will be doing another topic that is very important. This topic is called misuse of painkillers. Not this one. Misuse of painkillers. Misuse of painkillers and complications. So everyone who is getting in right now, everyone who is on, welcome to this. See. Yes, friends, welcome to the channel. Today we want to talk about painkillers and welcome to the channel. Today we want to talk about we will be talking about painkillers and headaches, how people misuse painkillers and when you have chronic headaches. We had to do the topic, but request was there yesterday, and we have to. Let's see this one. Setting things here, just relax, setting here things. The network today is very slow. I don't know why the network is becoming so slow and loading things very slowly. But everyone who is watching, welcome to the channel. Welcome to the channel, everyone. Welcome to the channel. Today we want to talk about misuse of antibiotics. And not antibiotic, painkillers when people have headaches. You know, sometimes when people have headaches, they really misuse painkillers. And then you start having other complications, several complications that are more worse than the headache that you had. You see, you get some more worse problems than the headaches you really had. So everyone who is coming in, thank you for tuning in. Thank you for coming in. Thank you for tuning in to the channel. And we want to talk about a very important topic, that is misuse of painkillers when it comes to headaches. And you saw Shadex, hi, welcome. Shadex ZQ8E. Shadex, welcome to the channel. Hope you have tuned in and you have subscribed to the channel. Hope you have tuned in and you have subscribed to the channel. You see, so we'll be talking about misuse of painkillers. Some people really misuse painkillers a lot when they have headaches, and you saw some headaches like the primary headaches. Like the primary headaches. Some people, the primary headaches, most of the time they don't need painkillers. You need to take rest, relax, and you need to take some antidepressants. But when you are just taking pain, you are taking drugs. You are taking drugs, just taking drugs. Just taking drugs and drugs and drugs and painkillers always, you may end up having a problem that is very bad. You may end up having a problem with other organs. So, getting analgesics are painkillers. Analgesics are painkillers. It's okay. But when you're taking analgesics in the wrong way, that is another problem. Let's talk about how people go for painkillers when they have headaches. You feel headaches and then you quickly go for painkillers. For painkillers, it is okay using analgesics, but chronic headaches like migraines, you may not require mostly analgesics. What you may require mostly when it comes to migraines is antidepressant, rest, and staying away from things that excite the pain. But you may find that some people will always be taking analgesics. When the pain increases, you take analgesics. And that is why today we want to talk about this. We want to talk about this problem. Now, we have misuse of painkillers means taking a lot of painkillers too often. Every time you are on painkillers, taking higher doses than prescribed, combining similar medicine at times. The medicines that you take for painkillers, it may be acetaminophen, but with different brandings from different companies. So you take this from this company and then you see it's not working. You go and take from another company, you see that it's not working. That is misuse of painkillers, and that's why we say prescriptions are very important. Using someone's prescribed medicine is bad. Stan's Kitchen, just jumping in to say hi. Hi Stans, welcome. Thanks a lot for jumping in. Today I'm talking about painkillers and chronic headaches. So when you have chronic headaches, we saw that headaches are different. You may not have the headache that someone else has. Because maybe someone else is suffering from primary headaches like migraine, clusters, headaches, tension type, and the trigeminal, autonomic, cephala. You may be suffering from primary headaches, which are migraines, cluster headaches, trigeminal autonomic, cephalagias, and also tension type. You see, and you've gone to take another medication that was prescribed from another doctor to another client that had secondary to something else. You see, so these type of headaches do not match, and you are using the same prescription. So a prescription from someone else, is not what you need. What you need is a diagnosed medication from your doctor with the problem that you have, or sometimes using them for headaches on many days. You use the drugs for many days, paracetamol every day, and you have vital organs that are very important. Metabolism in your liver, when you use drugs for so long, is a problem. It can make even headaches worse. Now we talk about prescriptions and headaches. So let me see, if someone has a migraine headache, we said you need to rest and get some antidepressant. so that it may raise serotonin in your brain, and then the headache can calm down because it will be suppressing the components that the nerves, like trigeminal nerve. We said in your brain there are 12 cranial nerves, but there are 3 nerves that are associated with headaches. The cranial nerves, 3 nerves that are really associated with headaches. One is trigeminal nerve that has 3 divisions: ophthalmic, maxillary, and mandibular. And then we have the other one, which is glossopharyngeal, cranial nerve number 9 and number 10, which is vagus. They are the most ones that excite. When you excite them, they produce calcitonin gene related peptide, substance P, and calcitonin. Substance P and neurokinin A, sorry, not calcitonin. So they make you have headaches. So when you take antidepressants, they raise serotonin and they suppress this other one. You see, the most important complication is medication overuse, also called rebound headache. When you use a lot of painkillers, you will get something that is called rebound headache. You see, when you use a lot of painkillers, it will go down a bit and then you get a rebound headache from painkillers. It occurs when pain relief medicine is frequently used for migraines or tension type headache. Tension type headache, when your muscles and skin are having tension and then you get headache. When you know you are diagnosed with migraines, please don't use a lot of painkillers. You will come and have another thing that is called rebound headache. If you know you have several headaches that come every time, very important, check on your doctor. Because the diagnosis of your doctor according to your headaches will give you a better prescription of antibiotic. You see, the headache may become nearly daily. Daily you are having a headache. Daily. Imagine you are using painkillers on the wrong type of headache, and then it brings back the headache in full, rebound headache. Less responsive to medicine and return as a dose wears out. So when the dose goes down, it brings about, can see Dorothy in the house. Dorothy, welcome to the platform. We are talking about misuse of painkillers. Misuse of painkillers when it comes to headaches. So primary headaches, tension type, cluster headaches, trigeminal, autonomic cephalagias, those 4, don't use a lot of painkillers. Why? Because, hello Dr. Benjamin, how are you doing? I'm fine, I'm doing fine. We are just discussing something about painkillers and headaches. Because as you use a lot of analgesics, painkillers, be it NSAIDs, be it all of those, after you've used the painkiller several times, what you will have is another headache that is called rebound headache. And what does a rebound headache do? It is more painful than the normal headache. Why? Because of one thing. Metabolism of the headache, of the painkillers in your liver increases. Peace be upon you. Thank you, Ciao, Ahmed, thank you for joining. So you are using a lot of painkillers, and then the metabolites, when metabolism is happening, it excites the nerve, and the nerves start making you feel the headache by releasing the 4 things that we talked about, the 3 things that we talked about: calcitonin gene related peptide, substance P, and neurokinin A. So when There are some drugs that are really associated with these headaches. If you have a question concerning this, my friends, if you have a question concerning this topic of painkillers and headache and how painkillers can in turn give you headaches, you ask. You see, it is especially associated with frequent use of paracetamol, brufen, diclofenac, and NSAIDs. NSAIDs are drugs like diclofenac, aceclofenac, all those aspirin. Combination headaches medicine containing caffeine. There are some medicine that you go in the over the counter and you see paracetamol, aspirin, and caffeine. Don't use those medications for long. Just use them once when you don't have any other option, because the caffeine and the aspirin in it, the NSAID, may end up giving you a lot of pain. Remember, aspirin, NSAID, diclofenac, aceclofenac will give you acidity, and after acidity, what will you have? After acidity, what you will have is a lot of headache with acid. So it is giving you double trouble. Opioids, painkillers such as codeine and tramadol. There is this is for the ladies. Ladies, most of the time, they will come and tell you, when I'm in my menses are very painful. My menstrual cycle, in their cycle, and some say it's only tramadol that makes me, and they overuse it. Tramadol is a medication that is good for pain, but under prescription, because it has got its own side effects. You see, a practical warning sign is need pain medication for more than 2 to 3 weeks to 3 days per week. 2 to 3 days per week you are on painkillers. Imagine 2 to 3 days per week you are on painkillers. Regular for several weeks. In chronic headache disorders, medication overuse. Headache is generally considered when simple painkillers are used for more than 15 or more days in a month. You see, there are some things like opioids that you can use, and some people are always on opioids. You half of the month, 15 days, if you calculate the days you have used opioids are more than 15 days, just know you have been addicted to. And the drugs that you are using for pain, you are using them for the wrong cause. And it's not because of the pain. Because the headache that comes in a month and then you are using it for like 2 days, it's over, you forget about painkillers, it's okay. But imagine in a month, you are always on medication because of headaches. It means there is something that is making you feel headache and that you are not taking care of it. Let's talk about complications of this, the complications of taking this. And the first thing that I will say is, when you swallow a drug, it has to go through the blood system. And when it goes through the blood system, where it goes first is to the liver. And why do it go to the liver? Because anything that you put in your body, it's supposed to help you, and after use, to get out of your body, because the more it stays, it can injure your body, even drugs. So anything that binds to protein and fats cannot get out of your body. Why? Because your body is protein and fats. So you need to change that thing into water soluble so that you can remove it from your body. And that's why the liver is there. Detoxification, metabolism, breaking it down to water soluble, conjugation. You get that? It's called conjugation. So when you take painkillers, what happens? When you take painkillers, it's absorbed to the bloodstream, and it goes to the liver. And some others are transported through proteins and others are transported through water. So when it goes to the liver, what happens in the liver? The liver starts to work on breaking it down and changing it to water soluble. And in this process of changing it to water soluble, this is where problems are, because if you take too much of painkillers, the liver does a lot of work, and hepatocytes, the liver cells, they damage. Even if you go to the gym, and you start working out long hours and running long hours, you will injure yourself, your muscles will rupture. So even in the liver, if you have seen some people that take some drugs and they start yellow eyes and yellow palms. Why is this happening? Because now the liver cells work so hard and then they start breaking down themselves, producing heme and iron, where the yellow substance is brought by the breakdown, which is called bilirubin. So it is not water soluble, it is still in protein soluble. That's why it comes and deposits. As it goes through the bloodstream, it deposits in your eyes. You can see it, your palms, where if you are so light skinned, you can see even there. And that is what we call jaundice. Drug complication that brings jaundice. Jaundice second to. So too much paracetamol, the drugs that we have talked about, brufen, diclofenac, NSAIDs, too much of them. Yes, African mom has said hello. African mom, welcome. Hello to you too. Welcome to my channel, Benjamin the Wise Guy. So when you take too much of drugs, we have talked about what the liver does. Although there are some drugs, when you take them, immediately they go to the bloodstream. In the blood, it is directly metabolized. But conjugation is in the liver. So when you take the drug, it goes to your stomach, streams to yes, thank you, greetings to everyone, welcome, streams to the liver starts the work. It's the enzymes that work these processes, they work, and you have taken, and that's why we give dosages, Welcome everyone. If it's your first time in this channel, don't forget to subscribe and come to the chat and tell us where you are watching from, very important, and hit the like button. You see, so when you have taken, it has gone to the bloodstream, it has gone up to the liver, and you are over the dosage because you are thinking you have a lot of headache, and by giving more of drugs, of the analgesics, will bring the headache down. The problem starts. The liver is overdosed. Remember, there is something when we give drugs, painkillers, even painkillers, any drug that you take, there is something that we check on, which is so important. One, it is called bioavailability. Two is called dosage. Three is called half-life. Bioavailability is how much of the drug will be in your bloodstream. Welcome, my friends. If you are watching, it's your first time here, hit the like button and subscribe. Tell us where you are following this from, and tell us how you're feeling about the topic. Today we are talking about antibiotics and misuse when you have headaches. You see, I can see African Mom, Ahmed, Dorothy K. The other ones, please tell us where you're watching from. Let's interact, my friends. So, what is bioavailability? the amount of medicine that is in your bloodstream. What is half-life? The number of hours or minutes that drug will have been broken down into the half of what you took. See? So that's why we have something that is called dosage. You don't just give drugs. No, we check on those three: bioavailability, half-life of that drug. So when you take it, we know if it surpasses the bioavailability is 75. When you take, before it gets to the bloodstream, maybe it will be 65% of 1000 milligrams. The only thing that has 100% of bioavailability in your body is the only thing that has 100% in your body is the one that is intravenous. But we look at it and we say, oh, if you take this drug, it is liver toxic. This guy on coke, why he looked like Connor in the Red House interview? Straight bug eyes. Okay, now let's talk about when you have taken it, the broken down, the time. So half-life, we look at it and we say between 2 hours it will be broken down and it will be away from your body, so it will not injure your liver. So the good dosage is like 500 milligrams, so that it cannot surpass the half-life, the amount of hours that it will be broken down into what you have taken. That is how dosages are taken. That is how dosages are calculated. And all these drugs that you take over the counter, they contain their own half-life, the number of milligrams that will be broken down into half as you take it. You see? So you, because you have a severe headache like migraine, never take, when you are diagnosed with primary headaches, never take painkillers more than 2 days. See a doctor. Why? Because primary headaches come as a disease of their own. It is not secondary to something else that you might be managing. So you have a migraine today, you take paracetamol. Tomorrow, you take another paracetamol. The other day, you take another medication. Now you jump to NSAID, diclofenac. And then now, you get out of NSAIDs, and what do? You start taking another opioids, COX-B. The liver has a half-life. Maybe the half-life of opioids is longer than paracetamol. So you forget that you are taking paracetamol and you are on NSAID, and then you take an opioid. All these drugs are conjugated and metabolized in the liver. Serious complications. Too much like paracetamol can seriously injure the liver. The risk when several cold and flu medications are taken, and you have noticed several cold and flu drugs have paracetamol in them. Check on that. Very important. And I've said, you take all these drugs within a short span. They are still conjugated in the liver. The more the enzyme work, the more the liver cells, they are called the hepatocytes, the more the liver cells are damaged. And as the liver cells are damaged, let me check on this. What happens? You start having jaundice, broken down liver cells. You have yellow eyes, yellow palms, and if it is a kid, confusion, encephalopathy. What is encephalopathy? It is confusion because a lot of bilirubin When liver cells die, they break down into heme and iron, and then they produce something that is called bilirubin. So too much bilirubin injures the brain, and then you start being confused and delirious, and then you start having, that's why most of the people that have damaged liver, you will see them having confusion sometimes. See, let's talk about something that is concerning the liver. Let's talk about something that is called stomach irritation, ulcers, and bleeding. Non-steroidal anti-inflammatory drugs such as brufen, diclofenac, naproxen, and aspirin. They cause gastric ulcers. They reduce the lining, the mucus lining, and protective layer of your stomach. And then the hydrochloric acid, because your stomach has hydrochloric acid that helps digestion at a minimal amount, starts to injure your stomach, and then you start having ulcers, because if the too much ulcers and the protection of your abdomen is not okay, you start having ulcers. The bleeding, because it is in the stomach, produces something that is called digested blood. Digested blood is called marina. So when you go to the loo, you see black stool. And what does black stool symbolize? Upper gastric region problems. Now you go to the hospital. You have not told your doctor your history about taking medications. You start to do very many tests, being exposed to laboratory H. pylori, being exposed to radiology, you see, using your finances. And it's a problem that you yourself brought it. And that's why some countries never go over the counter. You need a prescription even for painkillers. So you have taken a lot of painkillers, you put in your house and you say, I cannot stay without these drugs. Yes, bleeding as well. Because non-steroidal anti-inflammatory drugs like diclofenac, when you take them a lot, they injure the abdominal lining, the mucus layer that protects your stomach with the cells that are there. So they leave your abdomen prone to exposed to hydrochloric acid that is in your stomach, and then you start having ulcers. Start bleeding, and bleeding, you go to, if you are having abdominal pain with headaches, and you are going the loo, black stool, you need to check on your doctor. Very important sign: abdominal pain, headaches, and black stool. It is called marina, digested. Go see your doctor. Tell your doctor, I'm having abdominal pain, I've been using this medication. Don't forget to tell your doctor which kind of medication you have used, and tell your doctor about your headaches and the black stool that you are going. Some children, they go black stool, and then you say it is they are eating that, and you're the ones only subjecting them to anti-analgesics that contain paracetamol, or drugs, syrups that contain paracetamol and they are for flu. Be checking those blended drugs, and that's why for me personally, I don't give children blended drugs. I give according to what I've seen. If this child needs paracetamol for fever, I'll write paracetamol. If this child needs cetirizine for running nose antihistamine, I will write cetirizine. I will not look for a drug that has paracetamol, cetirizine, and because of the dosage that I want. And remember, We have talked about several things that are important: bioavailability, half-life of the drugs, and dosage, milligrams and grams that a person needs according to age and what? Liver damage, the condition of your liver. We just don't give. You cannot give a person who has liver damage, who is undergoing treatment, paracetamol more than 1,000 milligrams in a day. You'll be killing that person. Kidney injury. Let's talk about kidney injury. Oh, before I go to kidney injury, alcoholics, stomach with nothing. You have been taking alcohol and then you are taking medications like NSAIDs. My friend, you are killing your liver and you are giving yourself stress of pain because of ulcerations. Kidney injury and fluid retention. Frequent use of diclofenac, aspirins, and brufen, which are called NSAIDs, use can reduce kidney function. When I'm saying kidney function, is blood flow to the kidney, especially when you take often and on an empty stomach. It worsens the blood pressure. It worsens the blood pressure. So your pressure goes high because of water retention in your kidney. You may have a condition called hydronephrosis. Kidney damage. If you have not watched our video on kidney function, please go and watch it. You will understand. In dehydration and blood thinners, dehydration and kidney diseases. There are some people who have diseases like pyelonephritis. Some people have diseases like nephritic syndrome. You see, those are very important things you need to put on your when you're considering over-the-counter analgesics. You get? Check on that. It's very important. You have, and I've been talking about something that is called, yes, I watched the video on kidney function. Yeah, and now you understand why when the nephrons pause, block, pressure goes up and filtration rate goes down. Your kidney cannot filter anymore. Remember, there are some drugs also that are metabolized in the kidney. Others are metabolized in the blood stream, and the blood is still going through the kidney. Kidney injury causes anemia. Kidney injury causes anemia. People that have kidney problems, you will see them very pale. And why is that? The kidney produces a hormone that is called erythropoietin that enables to produce more red blood cells from the stem cells in your long bones like femur and humerus. See how painkillers are associated with very many things, are associated, interconnected. And that's why only a consultation from a professional can help. Raised blood pressure and heart risk. Some NSAIDs may raise blood pressure and increase cardiovascular risk when used repeatedly or at high doses, even diclofenac, aspirins. They can. So you are taking, you have primary headaches and you are taking NSAIDs. You go over the counter. Dr. Benjamin, greetings and blessings to everyone in the chat. Thank you so much, Smile in the City, for tuning in. Apologies to a Jamaican uncle is doing something. You may not see him today. He's somewhere very busy. So, the more your blood pressure goes, and you see, rebound headaches. You are having primary headaches and you are taking more painkillers, injuring your kidney. In turn, you become anemic and you start having hypertension. Now, the high blood pressure brings back rebound headache by irritation of the three nerves that are important: trigeminal nerve, glossopharyngeal number 9, and vagus number 10. When they are irritated, they produce calcitonin gene-related peptide, substance P and uroquinin A. And those ones are the ones, as they help them recover, they are giving you headache. You see how these things are related. And I'm saying, if you have primary headaches, take painkillers. Things that Benjamin, blessings Marie, welcome. Welcome to the chat. If you have primary headaches, migraines, clusters, tension type, autonomic, trigeminal autonomic cephalagias, see a doctor. Let the doctor guide you on what to do, because you will not require painkillers to relieve those headaches. In my practice, I'm not used to give people painkillers unless the initial state of seeing this person, and I want this person to be comfortable so that I can get information. Get to know the problem, handle the problem, let the pain subside gradually. So kidney injury and fluid retention is very bad. And you see, it is brought by NSAIDs, diclofenac, injuring the kidney, start being anemic, raised blood pressure. Guys, if you are watching and you have any question, don't fail to ask a question. Just put your question up and I will be ready to answer. Now, there is a very important thing that we need to talk about. What is this important thing? Drug interaction and accidental overdose. Drug is an interaction, is whereby you are taking this painkiller and you're taking the other one and you're taking something like a diuretic. Maybe you are hypertension. So when you take them, they interact, they form something else. They react. Let me say that. They react. You know, there are some drugs when you mix them, they form crystals. It is called drug interaction. It is called drug interaction. So excessive use of these painkillers you imagine you are taking analgesics, painkillers for headache, and you take like a drug like Brufen, naproxen, aspirin, and ketorolac, and you take, they interact in your body, they form crystals, and those crystals go to your kidney and they start bringing problems. Those people that like mixing drugs, this one I've used, it's not working, you jump to another one. Now, today you take both of them. It is called drug interaction. Most of drug interaction form crystals. Hmm? It is not correct to use analgesics. And I'm repeating, primary headache, see a doctor. If you have been given a painkiller and it's not working as per your expectation, go back to the same doctor, tell the doctor that the drug that you gave, it is helping, yes, but it's not per my expectation. Let the doctor know what to do, because you will go over the counter, you will get most of analgesics, most of painkillers are over the counter. You will be sold. The drug interaction now will come up, and the drug interaction will give you more problems. High blood pressure, because when you have kidney problem by water retention because of drug interaction, what happens? You have high blood pressure. Removing these crystals from your kidney takes a lot of time, and most of them brings some other problems. Start having kidney stones because they attract some things that are called oxalates and calcium. Form stones in your kidney. Interactions. Wrong use of analgesics and chronic use of analgesics and painkillers. My guys, you see that? Drug interaction is very bad. Drug interaction is very bad. You have seen how from something that you don't know, helping yourself can lead to another bad complication. We started with the liver, now we are at the kidney level. And at the kidney level, we are talking about drug interactions. Drug interactions. That one is Cute Jersey. Cute Jersey, hey, welcome to the chat. Welcome. Yeah? It is appropriate for you to get the right medication when you have seen a doctor. And that's why I came to sensitize this. This topic is for sensitization. Dr. Bell and everyone, thank you so much for tuning in, Margie and Cute Jazz. You see, and why? Now I know, but this shopkeeper selling sugar and stocking painkillers as well to Koshin. Yes, analgesics, I don't know why, but the regulatory board, like today I woke up in the morning and in the news, the PS had, Miss Marie, I'm on your channel right now. Thanks for supporting Miss Marie Smiler. The PS had said the delivery of drugs with motorcycles has been abolished. Online pharmacy in Kenya. Go online, you take a drug, it is delivered. You go in a supermarket, you pick a painkiller and you are sold. So for you taking, and some people, they don't care, because if you don't sell for them, they'll be mad at you. They'll tell you, why are you not selling me this? And it's the only thing that helps me when I want to sleep. You tell this person, yes, that is a step in the right direction. It is a step in the right direction. I've seen some patients that have come for my consultation after taking a lot of painkillers. And they come with kidney stones. They come with hypertension. A person who did not have hypertension. You do liver function, you see all the enzymes are up. You see, you do kidney function, you find creatinine is elevated. Treating this person becomes more expensive than initially if this person could come to you faster. painkillers, my friend. I saw that, and I saw at least that move was good. That move was good. There are some people that are used to opioids and cocaine. There are some painkillers that are mixed with codeine. Medication overuse often causes difficult to treat. Tolerance. Need more medicine for the same problem. Withdrawal and withdrawings from that becomes a problem. Codeine has respiratory suppression when mixed with alcohol and sleeping tablets. That's why you see some people, when they have overused it, you will find them. Maja is saying, I try to avoid painkillers because I don't know why. I don't why I have pain, so I consult the profession. Very important. Please continue like that. Very important. Those people that like coffee a lot and they take painkillers, some products combine paracetamol, aspirin, and caffeine. And those ones in Kenya, is painkillers addictive? What is the long-term effect? The long-term effect is liver failure and kidney failure. Painkillers are addictive mentally when you think you know the right thing that you are doing for yourself. The kind of saying addiction in painkillers is not there. It is just your mental, But you can be addicted to painkillers that have opioids and codeine. You can be addicted to them. So here we have products that have some products that have combined paracetamol, caffeine, and aspirin. They may work quickly, but the risk of medication overuse, headache, because they are easy to be repeated. They suppress your headache, so after 2 hours you may end up getting another one. And then remember, you are suffering from primary headache and you're not taking the right medication, because with primary headaches, cluster type, migraine, tension type, and trigeminal autonomic cephalagias, they don't need painkillers. You don't need analgesics as per se. Continuously take painkillers. They relieve you have a rebound headache. They relieve you have a rebound headache, and then after a week you start having high blood pressure because kidney is failing and the liver the damage is coming, and then you have yellow eyes. Mixing problems and problems. And normally socially, there are some people in the community, sometimes they think they know everything. They'll come to a hospital, they find you, and they will look at you, you look skinny or younger, you don't have the body like them, and they have gone to school a bit. You're not going to school a bit, you understand? Even they have gone to school, but they want to direct you as a doctor on what to do. As a doctor, what should you do? Be ethical, be professional. This person tells you that this is what I do and this is what I want, even if this person is learned and has some papers than you, maybe PhDs, or be professional. Explain. Yes, they know it all. Explain to this person as per your knowledge. Direct this person as per your knowledge. If this person is very categorical, this is what I want, they have come to you for help, but they want to direct you on what they think. with all, I usually tell people with all the respect that I have as a doctor and as a medical practitioner or as a health worker, I request you to follow my advice by doing this, this, and this. If this person stays adamant, always make sure sign against doctor's advice. Very important. If you have a private clinic, if you have a hospital, you are working in a hospital anywhere, even a public hospital, what you should do is make sure this person signs against medical advice in a respectful way. Just tell this person, you know, I'm bound by some laws and I respect your will, but please just sign for me here, because what I've told you is my advice, but I think you have your own ways to do things, so you just sign here and tell, and this will show that we had a discussion, but you preferred your own. Let this person sign, so that when problems come in future, it will not be trailed to someone like you who went to school 7 good years, 6 good years, 5 good years, and still doing as per directed to someone that is not in your profession. And that's why most people, when they are given that sign against medical advice, they become so irritated. Why should you put a doctor in problems when you know it all? Mixing painkillers and interaction. Taking brufen plus diclofenac or naproxen increases ulcers, because all of them are NSAIDs, and they will reduce your stomach layer. Reducing your stomach layer causes hydrochloric acid in your stomach to burn. You are starting to have ulcers. Don't forget, guys, please double tap the screen if you are using a small to support me, Benjamin. That is Smiler in the City, saying to you guys, and I'm still reminding you guys, if you have any question, please ask. Fiona, hi Mr. Benjamin. Yes, Fiona. Hope you are doing good, Fiona. And Uganda is a blessing, and Uganda is good. I'm fine, Fiona. Today we are talking about people that misuse drugs when they have headaches. Taking NSAIDs like diclofenac and brufen with some blood pressure medicine or diuretics. I'm recovering from malaria and typhoid. Oh, sorry. Hope you took some antimalarials like artemether, lumefantrine, and you are given an antibiotic for typhoid. Hope you are given that. You see? So well, thank you, and you'll feel good. We don't like people feeling sick every time. Fiona, hope you have taken artemether, lumefantrine. We don't want hypnotic. Yes, I'm on treatment. Yes, thank you. We don't want hypnotic malaria to get to the liver, because when they hypnotize, treating malaria becomes so bad. You take NSAIDs, you take brufen. Question, doc, does this apply to the use of supplements too? Yes, there are some supplements that may interact with painkillers. If you are given, you will be told. But for supplements, most of them, they don't interact unless a specific one, but I'll find out. Most of them does not. Now, if you are coming in right now, this is Dr. Ben taking you through misuse of painkillers with headaches. Your first day, please hit the like button and subscribe here. Yeah. Let's talk about people that are hypertensive. Their blood pressures are high and they take painkillers. If your blood pressures are high, my friends, please don't take NSAIDs. Don't take Brufen, don't take diclofenac, and you are on drugs that are called diuretics like furosemide. Can worsen kidney function, especially during dehydration. You see that? If you are here and listening, or your friend is there, and you know this friend of yours is hypertensive and is taking drugs that are called diuretics, please don't use them with NSAIDs. Brufen, aspirin, diclofenac, aceclofenac, those drugs, naproxen. Don't. They will worsen kidney function. My friends, I hope today I'm very slowly and people are understanding my plea to people not to be using painkillers all the time. Painkillers always, always painkillers. With no, you see, taking opioids with alcohol or sleep tablets can dangerously, and those tablets that have codeine can slow your breathing, and you know, slowing breathing when you are sleeping, we may find you in another world. Taking more drugs with paracetamol because of branding, companies different, and they still have paracetamol. What will happen? You will have liver toxicity. Your liver will damage. Rebound tenderness, headache. You are healing headaches and then you are bringing headaches up again. You are having a thunderclap headache, secondary headache, and you are taking painkillers at home, waiting it to subside. And thunderclap headache is associated with hemorrhage, internal bleeding, more double trouble, late diagnosis, late problems. You see, headaches is a very serious topic. And we should check on how we are using painkillers. It's Chwea. Hi everyone. Chwea, welcome to the chat. You seek intervention, a sudden worst ever headache or headache after a head injury. Your head injury entails 3: contusion, concussion, and compression. So most people that have tumors growing on the head, you should be seeing your doctor always. Compression, that tumor is under compression headaches. Contusion, something hit you and then it protruded and you removed it from your head and then you started having headaches. Go to see a doctor. Those are things that are very important. You're just seated like this and then you hear a very bad headache coming, and then you hold your head like this. Just tell anyone who is around, please take me to a doctor, please. It's very important. It is very important. Yellow eyes, skin, dark urine, confusion, or severe abdominal pain after taking paracetamol. Paracetamol is associated with liver damage, liver toxicity. Paracetamol, acetaminophen. when you go take a lot of paracetamol, damages the liver cells. So you start having dark stool, and dark stool is associated with bleeding from the stomach, and confusion is associated with the bilirubin that is produced after the liver cells are damaged. It is associated with brain toxicity, encephalopathy, confusion. You see, lead through urine, swelling from your feet, severe drowsiness, or slow, shallow breathing after pain medication. I've just taken pain medication that we have talked about because of a headache, and then you start breathing very slowly. And if you look at that person, the face is swollen, the legs are swollen. This person is drowsy. There is no urine. You can stay like 2 days, you are not getting to the. Please go to the hospital. That is called renal toxicity. Kidney function is bad. Severe stomach pain, we have talked about. Vomiting blood, black stool, weak numbed facial droop, difficulty in speaking, fainting, seizures, or loss of vision. You see, these are things. Queen is here. Bernard Bless. Blessings, Dr. Benjamin. Watching and supporting. Thanks a lot, Queen. I'm used to Queen. You know, even if you come with Bernard Blessed, I still used to Queen. You see how these things are interconnected, my friends. You take painkillers, and you know painkillers, the way I've said, the most important things that we look at when we are giving you painkillers are, is this primary headache or this secondary headache? Burn out to be blessed. Yes, burn out to be blessed. Okay. So we check on, this is how we check on it. We don't just give painkillers on headaches. No. You are having a headache, yes. First, is it primary headache or is it secondary headache? Say, it is secondary. We check on what is bringing the headache. Is it hypertension? Is it diabetes? Is it dehydration? Is it stomach ulcerations? Then we deal with that thing so that your headache can come down. Is it primary headache? Yes. Is it migraine without aura or migraine with aura? Is it cluster headache? Is it tension type? Is it autonomic, trigeminal autonomic cephalgias? We categorize and then we know, this one will help. If you come to me with primary headache, first thing I'll do, I'll not give you analgesics. I'll give you sumatriptan. And I'll tell you go and for 2 hours in a dark room. The time you are waking up, the headache will have gone. Sumatriptan. Serotonin agonist, receptor agonist. Because as the serotonin is coming up, it is suppressing calcitonin gene-related peptide, substance P, and neurotonin A that your nerves are producing, especially trigeminal, glossopharyngeal number 9, and vagus in your brain, and it is suppressing them. And as they go down, you feel relieved and good. No analgesics. You see that? This is how to manage things. Welcome everyone. I can see people are coming in. If you have a question about painkillers and headaches, don't fail to ask. And if you are new to the channel, please hit the like button, subscribe, tell us where you're watching from. Let's come on and relate. I know now you are getting yourself to know. That's why some people are used to drugs and they're not working. You've seen a person coming to hospital and this person will tell you, doctor, please give me a drug that is so strong because these headaches never stop. The strongest drug, and I usually tell people, for me, there is no vocabulary in my mind like the strongest drug. The vocabulary I have, it's the perfect working drug. The drug that will help you as per need or that you have. Now, you have migraines with the aura and you are taking paracetamol. You have migraines with the aura and you are taking celecoxib opioids. The ones that say this is a very expensive drug. And I don't know why people, you always associate expensive drugs, you associate expensive drug to the best drug. What a confusion. If you have headaches and fever, even if you have a lot of money loaded, don't go for the expensive drug. Just get the normal paracetamols for cents. Let the pyrexia go down and your headache will be okay. Go to a doctor, get some medication, and you'll be fine. But because now you have gone to a doctor and a doctor has given you a good prescription of amitriptyline, which is very cheap antidepressant, and you have a headache, you see this doctor is this doctor really okay? Giving me 2 cents medication, and this headache is it, and I have money. You go to another one, the other one tell you, this combination is good, but it comes with $2. And you think you have got the best because it's the most expensive, the strongest. In medicine, there is nothing like strong drug. Get this right. That vocabulary should, if you are a medical practitioner and you are watching me, don't tell me it is very strong. Tell me the pharmacokinetism and pharmacodynamism, how the drug works to the body and how the body responds to the drug. Don't tell me about this drug, my friend. If you tell me that and you are a medical practitioner, you are a doctor or a health worker, I wish I could return you to school. Drugs work as per needed. And I've said this, the right course of drug under diagnosis, bioavailability, which means the amount of drug that will be in the blood system after you have taken it orally or given it intravenous. Intravenous is 100%. That is 100% bioavailability because all the drug is going to the bloodstream. But when you take some drugs orally, like paracetamol, they are starting to be metabolized from your mouth, salivary amylase, breaking it down as it goes to your stomach. Then you will get like 65% of the drug is absorbed to the bloodstream. Guys, you bear with me. I'm kind of busy, so I'm not in the comments, but I'm here listening. Thanks, Cute Jassy. No worries, Cute Jassy. You are a lady with heavy menses and pain during menses, and you are taking analgesics like opioids, and they are not working because you are used to that expensive and you are a lady of class, you want to have a class. So you keep on increasing the dosage because the other ones are cheap. You want, my friend, get Buscopan, antispasmodic, be it cheap how it is. The pain that you are feeling is because of the spasms that you have. Antispasmodics, when the spasms are stopping, your pain reduces. But when you are in menses, ladies, you know, so many things happen. You get irritation of nerves. So the irritation of nerves, like the trigeminal nerve, the cranial nerve number 10, vagus, and glossopharyngeal number 9, producing calcitonin gene-related peptide substance P and urokinin A, you start vomiting, while the headache and the pain in the stomach is really pounding. See, that's why you go to a hospital, you are given antiemetic, promethazine, at least you will sleep well, and some serotonin agonist, sumapritan, and antispasmodic, the main one, to stop the spasms of the stomach so that the pain can reduce. Paracetamol cannot work. And you know, ladies are different. There are those that have painful menses and there are those that don't have painful menses. So I'm talking to those ones that have painful menses. And don't overdo. I usually say take the right drug for the right cause. And for headache, this topic that we are talking about right now, the sensitization of headache. Now you yourself, you have started noticing, oh, okay, yes, this is why when I take even Brufen, the headache stops a bit and then it comes back, rebound headache, because you are suffering from primary headache and not secondary headache. Even if you are suffering from secondary headache, get to know your problem. Don't tell us. You see, we said the people that wake up with headaches, you have to do an MRI, tumors, hypertension. Several issues may be growing and you are there saying, I usually wake up with headaches, but in the midday they subside. You know, I've been fasting, I've not been eating good, that's why I wake up with headaches. And then you wake up with headaches and next to you are painkillers, analgesics. And those analgesics next to you are NSAIDs, dangerous drugs. Let's get to that tree of complications. The tree of complications of painkillers. The tree of painkillers complications. You take them, they go to your stomach. And I'm saying when you take them, when there are many ulcerations and complications, when it is too much of painkillers you are taking. Start from the stomach, ulcerations. After that, it is absorbed to the bloodstream. It goes to the liver for conjugation. Liver hepatotoxicity. Hepatotoxicity says liver damage. Liver damage brings what? Bilirubin comes to the bloodstream. Jaundice. The brain suffers. Encephalopathy. Confusion. From there, you start having fatty liver, and then you have not conjugated the whole drug. Goes to the bloodstream down to the kidney. What comes out? Polynephritis, nephritic syndrome. Hypertension hits, pap. High blood pressure. Kidney stones, drugs that are not conjugated in a good way, they bring calcium. Too much water retention, you start having feet that are swollen, face that is swollen, crystals because you have mixed many drugs. Guys that are coming in right now, please don't fail to hit the like button and subscribe to the channel. You see how that tree comes in? Kidney injury, hits on, go to the hospital, kidney function is done. What happens? Creatinine elevation. The doctor writes, above this is very tough. What do you need? Go for dialysis first. On admission, we bring this down. After a good doctor, while you are in the ward, does a very good history, maybe even it's an intern or a student, the doctor looks at the history of a student and the intern sees chronic use of medication. Which one? And you know, people that have qualified, some things they don't. So someone that has just come from school will be keen, asking step by step. See, chronic use of analgesics. Now doctor notes, okay. That's why when we release this person, goes home, comes back with kidney toxicity. Relating kidney injury with headaches. Not relating the initial one, that this person when he's at home is always on painkillers because he is having primary headaches and not secondary headaches. Primary headaches that are not responding to painkillers. You all end up doing a lot of tests, MRI, kidney function, international memorization rate. You end up doing prothrombin. Sometimes even when you see enzymes of the liver are elevated, instead of thinking that this person can be having a drug problem, what do? You start asking for biopsy in the liver. You start asking for biopsy for the liver. FRC, welcome FRC. Big up where you are. Thanks for tuning in. So, from a little thing without knowing, because the person who went to hospital was okay, or the person who went over the counter for medication for headache is okay because he's trying to manage herself or himself. But without knowing, the person who is dispensing the medication sees you 2 times, 3 times, and this person does not ask you why. It's just dispensing the medication. Who is having a problem? The person who is dispensing or this person who is coming to buy? This person who is coming to buy is taking a step for helping himself or herself. So I don't see the big problem with this person. Person helping himself is not a big deal, you know. So I'll say this person is okay. Yeah? But now sensitization to the public about drugs, what I'm doing right now is very important. Many people are out here on dialysis because of chronic use of some drugs that could be avoided. My friends watching here, if you are watching for the first time, please come to the chat and tell us where you are watching from. Don't just drop. Tell us, I am so watching from this and I've learned something, or I would like to learn this specific thing. We will discuss. Like the topic of today was not planned. The topic of today is because of African Mom's World. Please check African Mom's World. Check what she's doing on her channel. For me, when you come to my channel, this is a channel of associating with each other. This is a channel of raising each other. This is a channel of making each other be empowered. sensitization. So if you come here and you have seen someone else as a channel, please go to that channel and support that channel. Empowering each other is the best thing. Don't just come here and say we are here because it's Benjamin the Wise Guy. You know, some people, when you go to their channel, they don't like telling people to support others. Even some people, when you support others in their channel, they feel bad. And it's bad. It's very bad. We are here to empower each other, like how I'm empowering you with some medical tips. And even me, in turn, I'm learning. Because if you ask a question and you say, in my way of life, in our village, in our part of the world, this is how we do it. We discuss it and then we integrate it. We integrate it to a good thing. And you see, the doctor has also learned through interaction. I'm saying this because I will not name, I went to a channel and these people are so excited to see me in that channel asking me questions. And I was telling them, when you feel you need to know more about something, just text me in my channel and I will answer you on any of the videos. Just text me, because I didn't want to give my number in one of the channel, and I will give you more and we will interact. And the host was very mad, just me telling them I can help you, just text on my channel later. And I felt it's being selfish. So I have not gone to that channel again because I avoid drama. I hate to say this because I felt I should say it sometimes. It's good to release some. And even I talked to Uncle, and Uncle said that is very bad. But it's okay. Every channel has got its rules. So if you go to another person's home, stick by the rules. In my channel, the rules only are, don't be insultive. Just text whatever you want, but don't be insultive and don't show content. You can text, interact, laugh, and we grow each other. The only rules are, don't be contemptuous, don't be insultive. That is my rule. Be civil. Yes, so we have talked about these things, my friend, and you know, Benjamin the Wise Guy is a good guy. The good guy who loves laughing and sharing advices of medical. So it's your turn to tell me what you think. It's your turn to tell me what you think about medications of pain and overuse. But I know someone has learned something, and I've said pain killers, chronic use in primary headaches, you are killing yourself slowly. You may end up finding yourself in dialysis center. Secondary headaches, see a doctor. Use analgesics, see a doctor to take care of what is bringing the headache. You see, I've talked for more than 1.5 hours, but the management of painkillers is very direct. Primary headaches, treat the auras like nausea, dehydration, take antidepressants, go and see a doctor. Secondary headaches, use painkillers, paracetamol, diclofenac, not overuse. Go and see a doctor. And if you don't know what primary and secondary headaches are, check the previous videos, go through them, you learn. We don't want people. Greetings, Dr. Benjamin and everyone. Hi, Beauty. Beauty is here, my friends. Beauty. You know, we have like that. We have friends, good friends. Now we have two beauties, T Beauty and Beauty. And then there is one Beauty. So our friends are beautiful. We have cute Jessie. You know, cute means beautiful. So cute just is another beauty. Yes. So that is it, my friends. Anyone with any question, it is your time to ask the doctor. It is your time to ask the doctor some questions. Dr. Benjamin, your lectures are priceless. Wow. How do I feel? How do I feel when someone says that? The only thing I say is glory to God. Let the public be sensitized. Let the public get the rightful information. Hello, my brother from another mother. You know, there is this guy that is called Surviving Men series. Now, I'm waiting for your questions, my friends. Awesome information. Surviving Men series. Hit the like button. Don't forget to double tap your screen and hope you have subscribed. Subscribe, my friend. Hit the like button. So today, you have noticed why people have liver failures. You have noticed how people get to dialysis. You have noticed. You have taken a lot of painkillers. The liver is not able to turn them to water soluble so that you can urinate and go as stool. And then the metabolites have gone to the kidney. The kidney cannot sieve metabolites that are having oxalates and calcium, so they block the nephrons. Reabsorption of glucose becomes a problem. High blood pressure goes up. It destroyed the nephrons by pushing the nephrons, so you start urinating proteins. I've been following you silently in the bush. Thank you, men in the series. Now, that's the problem starting. You go, you find that your creatinine levels are high. Creatinine is just a marker. Creatinine is something that is destroyed from when your protein diet proteins they disintegrate, you produce the creatinine. So it should not be more than, let me see, creatinine levels. In adults, it should not be more than 90. But you go find someone has 150. But if it is in micromole, that one is adult women is 90, 40 to 90. Adult men 60 to 110. A doctor tells you your kidneys, my friend, are not doing good. As we treat you, let's do a dialysis. You had primary headaches and they were not treated well. Your doctor did not advise as per needed, or yourself, you went to over the counter for several times. In your family, never. No one has ever had kidney failure. You are the one by giving yourself analgesics. No one has ever had liver failure. You are the one who started because you wrongly went for more than 1 year to a pharmacy over the counter, and the pharmacist, the pharmtech, did not reason out. This person was just giving you because the other pharmacists were denying you the opportunity to be given more. So you went to that one that loves you, in quotes. That is a good one, in quotes. That is a good one that don't follow medical protocols, but follows financial protocol by bringing in, selling you medicine, selling you cheap medicine, the expensive that you need, the strong. And for today, I've said, if someone is a medical practitioner, and you go and this medical practitioner tells you, use this one, it is the strongest. Look at that person like this. Look at that person like this. The one that is saying this medication is the strongest. The one that's saying this medication is the strongest. And go to the next one. And I've explained why in my world there is no term like strongest medicine. I have explained why. A drug should be given, even antibiotics, to the right course, following the dosage, the bioavailability in the bloodstream, and the half-life. The medication should factor in something that is called pharmacodynamism and pharmacokinetism. How the drug will work on your body, tissues and cells, and how your body will react to that drug. You see, and now we are talking about normal painkillers. Dr. Benjamin Arnoff today got to go walk 10,000 steps. Salute. Thank you so much. You see, guys, how we are relating, how the drug will work on your body. Let's go through the steps. 1, dosage. 2, bioavailability to the bloodstream. How much drug will end up to go to your blood? 3, half-life. How much of that drug will be broken down to half the milligrams that have gone to the body? 4, pharmacodynamism. 5, pharmacokinetism. How will that drug react with your body? And how will your body react to that drug? Will the kidney be injured? Will the liver be injured? Do you have any allergies of drugs? These paracetamols, these aspirins, these brufen that you usually take. Now you understand, my friend, why you went to a doctor one day and the doctor told you, no, I respect you, but I will not give you paracetamol. I'll give you aspirin. I respect you, but I will not give you this drug that contains caffeine, but I'll give you diclofenac at a low dose of 50 milligrams. You go to a doctor's office with a headache and a doctor looks at you and says, I'm not going to give you paracetamol, diclofenac, aspirin, or I will give you sumapritan or amitriptyline because you are suffering from primary headaches. The doctor looked at you, examined you, saw primary headaches, and knew the best thing to do in these primary headaches is to do what? To bring up serotonin. To bring up serotonin and bring down calcitonin, gene-related peptide substance P, the nerves that are because you have primary headaches. I can see Vinny Oyugi in the house. Vinny Oyugi, long time, bro, come in, be blessed, come in, ask a question. And then this Mr. Know-how, Mrs. Know-how goes home saying, how dare this doctor give me antidepressant? How dare? Do this doctor feel that I'm depressed? Metabolism of this drug is lighter, milligrams are low, and it will take good care of your primary headache. Rather than the metabolism of paracetamol and analgesics that are not working rightfully, and they will be having problems, the kidney and liver. Guys, let's avoid painkillers and get the right course of analgesics. You see, but I know today someone has learned. As I'm talking, I know you there, you have learned about painkillers now, the ones that we call analgesics, and we have learned about management of headaches, secondary and primary. You see, secondary and primary, and how these kind of headaches can be managed. We don't just give, we don't just give because you have a headache, we just give paracetamol. Any of choice that is on the counter, we give. No, I know most of you've ever had a headache and you had a problem because you are given something and it's not working. So you ended up getting some more drugs. If you take paracetamol today, brufen today, and that brufen has not worked, you still have the headache. Me, for my sake, I'm telling you, my friend who is watching, go to the next doctor, find out why the brufen is not working. Yes, the lecture, the talk has been good, my friends. It's more than 1 hour and a half, more than 1 hour and a half. We are going almost 2 hours, and I'm asking anyone with a question before I log out. It is question answer time. Anyone with a headache, my friends? Anyone with any question? If you have any question, it's okay, you can ask. If you have something that you can add, it is okay, you can add. And please share these lectures. And these lectures, ask Queen in the ask Queen on the chat. Queen today is called Burn Out to be Blessed. Ask, she is working on a dialysis center, and I will tell you, 75% of cases in the dialysis centers, in the dialysis areas, they started because of chronic use of alcohol and painkillers, analgesics. Long-time use of analgesics ended someone to start having. Yes, please do that, Smiler in the City. If you get someone who is our friend online, go and support that person. If a new video has come in, look at that. You learn something from what someone is doing, who is showing off. This is content world, and content world makes people learn. So anyone with a question, Beauty is in the house. Beauty, beautiful. Beauty, how do you manage to stay beautiful without drugs at your age? Beautiful with no painkillers, eh? Smiler in the City, you with Jamaican uncle, tell us how you manage to be strong, healthy, no headaches, with no painkillers, eh? You know, ways people survive, ways people avoid to visit Dr. Benjamin's office, ways people help someone else by giving a person some advice. Advise these people how you live, you know, how you stay without visiting Dr. Benjamin's office to get some medications. Anyone with a question, is your time. Question time. If you have not understood something, if you have a question, yeah, spinach and ginger drink, homemade. You see, spinach and ginger. Ginger is respiratory relaxer. It has nutrition, vitamin C, A. Ginger, they have nutritious, and they have, you see, cofactors are high, so you end up being healthy and your immunity going up. Anyone else? Anyone else, my friends? Let's see who has a question before I end up. My time is up. You know, I usually come 1.5 hours. Imagine it is 1 hour 44 minutes. NSAIDs are very bad for kidney, Motrin, and yes. Burnout to be blessed. Tell them. Tell everyone. You work in renal unit. I know. In renal unit, 75% of cases is because of NSAIDs. NSAIDs, and they cause hypertensive crisis. NSAIDs. You see. So guys, let me give a minute or two. Maybe someone is typing before I log out. I hope these talks are helping someone somewhere. And by helping someone, I know you where you are, you appreciate by watching the video, and you appreciate by sharing my videos. Just because if you share my videos, many people will get some knowledge. And you see how I explain. Having a talk on medical issues so tough because of medical terms, and I take lemon, ginger, turmeric, and garlic as tea every day. Yes, very nutritious. And I'm sure, Beauty, your blood pressure is not high, because if you are taking turmeric and ginger and garlic, releasing nitric oxide every day, you will not have high blood pressure. We give Tylenol in the dialysis center. Yes, Tylenol is good. Is good, but I know in the dialysis center people don't get NSAIDs. You will never go to a dialysis center and you get their NSAIDs. No, mostly NSAIDs that are intravenous, because they have Tylenol is acetaminophen, that is paracetamol. Paracetamol is less toxic to the kidney. You see, mostly the NSAIDs that are IV, no, it is not really given. It is not really given. So guys, don't worry. These are just tips to help you know about painkillers that you use. And you've seen they start giving you. Yes, I don't have BP, doctor. You see, if you tell me what you are doing, like how Beauty has said what she's using, I'll know this person can never have. People that love greens, you'll rarely see them with boils. You'll rarely see them with boils or respiratory issues. Greens. If those people that they call themselves like the Rastafarians who eat greens, you'll rarely see them with boils and some rashes and respiratory cases. Rarely, you see. And the concoctions that we use, like garlic, turmeric, people using them, some fruits, you will rarely see them with high blood pressure. That's the secret. Ask Beauty the secret. I know, Beauty, you didn't know about it, but now I'm giving you your secret. The value of your secret. The value of your secret is making you healthy and away from chronic issues, chronic diseases. You see. So guys, I think we have talked a lot. And if you have another question, those that have my number, you can text. Those that have my email address, you can always email me. If you are in Kenya and you want to meet me for a talk, I'm always there, but I have to give my secretary your number. Greetings, Dr. Ben and Chad, the person that I've been missing. Share travels. Share travels. I've become busy until I feel today I could text you and ask you, is everything okay, sis? But I hope you are okay. We have not talked for 3 days. Share travels, really? But it's okay. I know you are doing good. It's work. It's work. Even me sometimes. 2 days ago, I missed the live show. The queen has arrived. Baraka, but a smile on your face. Yes, I said 2 days ago, you see, I could not come online. Because the time that you should come online, you are being right, left, and center. And also on Saturday, it may be hard me coming online, but I'll know what to do. It's very hot in the US. Please hydrate if not on dialysis. Yes, please hydrate if not on dialysis. So that is it, my good friends. And my talk today has been right and okay, and I'm still insisting. Please have the social banking. Don't feel bad while supporting someone else. If you have met someone in, what is the B section? Beauty Simba, what is the B section? Oh, Beauty, please answer that. I've not got that. Let me see that. Let me see that. Okay. Okay. Now, if on dialysis limit your fluids, eat lot of ice chips. Yes. At least burnout to be blessed is Sha Travels. Today we have Queen changed the name and it's called Burnout to be Blessed, and is that's another channel. Someone may be confused. What is Burnout to be Blessed? That's a new channel, and we thank Burnout to be Blessed. That's a new channel. So support by everyone. So let me give a shout out to everyone before I leave. Sha Travels as a good channel. If you are here, you have not seen the channel, please see Sha Travels. Beauty Simba from South Africa, always blessed, and Cute Jessie, Smile in the City, Jamaican Uncle, there where he is always in the run, and here today is not here, but I know he's watching. Jamaican Uncle is getting a very good. Please, tomorrow's video, Jamaican Uncle, you will love it. You will love it, you know. That's why he's not here, but I know he's watching silently. Smile in the City, a band from the Queensland, and Efasi Lipenga, Vin Oyugi, everyone, African Moms World, Burnout to be Blessed, initially Queen, and the others. Let me see, Surviving Men series, you know, all of you that have watched, be blessed a lot. It's Choya from Qatar. It's Choya from Qatar. Thanks and be blessed. Fiona from Uganda. We wish you a quick recovery, Fiona. Hope you recover fast. Hope everything will be. We don't want malaria and typhoid to our people. So, Fiona, our lawyer in the making, you will feel good. I'll pray for you tonight, and I know you will feel good. African Moms World, Maje B, blessings always for your support and for your help to move this way of YouTube. You leaving me already, Dr. Ben? I'm about to cry. Hey, Sha Travels, I've been talking 2 hours and right now it is around 6:24 Kenyan time PM, and I have to do some things, you know. At everyone, I'm still hunting for watching hours. Currently, check on me and help me where you can. Yes, Cute Jessie, I usually run your vids, so don't worry. And I usually run your vids, and everything will be fine. You will be there, and everything will be cool. So that one, what are we having for dinner, Dr. Ben? Well, let me tell you, Sha Travels, you have reminded me I've not eaten anything from morning. It is 6:25 p.m. I need to take something so that I'll head home and know what to take. And you know, I'm heading home at 11. So I really don't know what my person will have prepared. I don't know today. Let me get home. I see. Our township are divided by sections, e.g. A, B, C, D, and so on. Oh, okay. That's why Sha Travels was asking about the D. So Sha Travels, I really don't know. I just want to take tea and wait what I'll get home. That is not healthy. You should always eat something, even a little snack. Yeah, I'll take tea right now. I'll take tea and wait for a surprise at home. A surprise at home. So, anyone with anything, I've been saying this before. let's end at 6:30 p.m. It is 6:26. 4 minutes is not bad. It's 6:26. So anyone with anything that you'd like to ask, I think you've heard about, and I thank God for my friends like Burnout to be blessed, Queen, because even doctor, please eat something. Yes, I will eat. I will eat. I woke up so early and I'm still here. It's okay, I'll eat. Big up Benjamin the wise guy. Kevin's worldwide. Kevin, welcome. Burnout to be blessed. Burnout to be blessed is initially Queen, and she has a new channel that is called Burnout to be blessed. Please support Burnout to be blessed. So for everyone that has been here, I want you to go through, and I was saying I thank God for my friends here in the chat. I'm talking about these things, they attest to them and they say yes, this is very important. You see, Burnout to be blessed works at a dialysis center, taking care of those people, and knows when I'm saying analgesics that are steroids, are NSAIDs, good. She's helping me to talk about this. When I was talking about eye problems, Sha Travels was there to back me up. You see how this social banking is so interesting. Social interaction and banking. We help, we get more in, because if I go a little bit wrong, I'll be corrected. And my friends, me, I don't fear being corrected, even on a live TV like this. On a live, if you correct me and I know it's right, I'll say, yes, it is right. I'm sorry, I went wrong. You see, and my friends who are my other medical practitioners here in Kenya, they go through. You remember sometimes one of them came, who was my classmate, and he said, Solomon said that you are doing a very great job, please continue. So it is, I'm not just talking to everyone who is not a doctor, I'm talking even to other people that are medics, and these videos are being watched even by students, medics in the making. So I like it when we talk about medical things and we are helping each other to grow and get there. Sensitization is the best word to use. And social banking and interaction. Social banking and interaction and growth is the best way to go. So, good friends, I think I've really talked a lot, and you're begging me to go and take something which is very important. Check if you have not liked the video, and Batista always comes late. Batista, you are coming when I'm leaving. Blessings to you. I see even you have given me a like from Brazil. But Batista, when I'm visiting Brazil, I told everyone that next year I'm getting some off and I'm starting to travel, visiting my friends. Batista, I don't know anyone from Brazil. I'll have to meet you when I get when I'm in Brazil. I'm staying somewhere. I'll be with you. So Batista, give me your connection. Get to my one of the videos. Leave me your number so that we can connect. My email address is benjaokwesh. I want to visit Brazil. okwesh@yahoo.com. People that use, someone told me that people that use Yahoo are old school, and I like it. So Batista, that is my email address. Hit me there your contact so that when I visit Brazil, I see you one day. See, teamwork. Yes. So thank you guys, thank you a lot for everything, and be blessed. If you are watching, you are new to the channel, you have been here always, thank you. Be blessed and support each other, my friends. Support each other that is in the chat. Let God make us prosper. People are struggling to get hours. What I may ask you to do, my friends, all my friends that are here, please, this is a request before I leave. This is a request. My friends are struggling to get hours. Burnout to be blessed, share travels, always the cute Jessie. Please, when you see these persons, just play it even for 1 hour. If you are not using it for 1 hour, or your television at home, just watch their videos. Even if you are not enjoying, just watch what this person is doing. Just promote that person with hours so that they can be monetized. Please, I'm begging my friends, please. So have a nice evening. Let me get some tea to take before I get home. Yes, Dr. Benjamin, dream works makes the team work. Yeah. Yes, dream work makes a team to work. Yes, and that's why, Smiler, I'm saying, like me, if I come to office and I see Share Travels is online, even if I'm not watching, and people always ask me, Doctor, are you obsessed with YouTube or what? You come to office and then you put on someone and then you go and you tell us not to change. Even if we are not, it's because I want to everyone who is watching me to prosper and to get ours. So that is it, my friends. Have a lovely day. May God bless you. Bye bye. See you guys. See you next time. See you tomorrow or 10 at night as we talk about. So I cannot go. If ever I want to go, another person comes. And if I leave when Coffee Cakes has come in, Coffee Cakes will not feel good. Coffee Cakes, I was just about to leave. Coffee Cakes. Today's topic has been so good. Let me say hi to Coffee Cakes before I go. This is for Coffee Cakes. Coffee Cakes, hope you are doing good. And we have not talked, but hope you are doing good. We were talking about the problems of headaches and being. Please redo the entire life for me. Oh. You will rewatch. That is my redoing. But Coffee Cakes, you need to rewatch this one, especially this. For you, it's very important. Please rewatch it. We have talked, and Queen has really helped me on this. So just let me, because I'm feeling so hungry, and I just wanted to say hi to you. Just leave me to go and take some tea, Coffee Cakes, and I think before I come online, I'll be sending you a message. I'll be sending you a message on WhatsApp. Travel has made me extremely tired. No worries, Coffee Cakes. I understand you. No worries. So bye everyone. Bye my friends. I may come today at 10 for a short session. A very short session on a topic that at 10 a.m. that is 6:30, 7:30, 8:30, 9:30, 10:30, 10. That is 3.5 hours from now. I may come 3.5 hours from now to do some 1, 2, 3 things that is very short. Then I will meet tomorrow for another. We continue with secondary headaches. But today I was talking about painkillers and problems with headaches with problems with painkillers. So my guys, my friends, I have to go. Please support each other. That is my cry. If you are here and you see someone is saying I'm struggling with hours, please just support that person. Bye bye. Be blessed, everyone.